Okay, is there anyone else that's going to join? About half of you are in there. Okay, we'll go ahead and get started here. So a 1-year-old with pneumonia is placed in a mist tent with oxygen. Which nursing intervention is the highest priority? To give small feedings, keep a bulb syringe at the bedside, chart the breath sounds, or encourage siblings to visit? Okay, pretty good job. So you would do all of those things more than likely, but when they have a respiratory infection and they're young, they tend to have really thick secretions, and you need to get those out so that you can help them breathe. So that's why that one is the higher priority. So the purpose of a knee to chest position in children with tetralogy of Fallot is lungs or to increase blood flow to the lungs. Good job. It's to increase blood flow to the lungs. I'm very impressed. All of you guys knew that. Great. So you're caring for a child with tetralogy of Fallot who suddenly becomes cyanotic with oxygen saturations of 60%. What is the first action? Give morphine, prepare to administer IV fluids, give oxygen at 100%, or place the child in a knee to chest position. Okay, so that is very similar to the last question. It's one of those things you really need to kind of file in your brain. A priority action with tetralogy of Fallot is that needed chest position. This is another one where to do all of these things. But the first thing you're going to do is put them on their back and push their knees into their chest. So what can cause rheumatic fever? Vomiting, strep throat, diarrhea, or a urinary tract infection? Very good. So it is the strep throat. So this is a select all that apply. What are some signs and symptoms of rheumatic fever? Heart valve damage, polyarthritis, chorea, and subcutaneous nodules over the joints, and up to all of them could be correct. All right, good job. So the heart valve damage is the thing that we worry about the most because they can end up with permanent heart damage. But all of these are possible signs and symptoms of rheumatic fever. Chorea is that involuntary movement of their hands, usually, kind of like a Parkinsonian movement. So this is another select all that apply. Rheumatic fever and rheumatic carditis diagnostic findings. What would you test for? What tests would you order? An ESR, a C-reactive protein, an ECG, and a myoglobin. It's the same thing. We're up to all of them, but could not be all of them also. Yeah, so the myoglobin is not something that you would test for. The ESR and the C-reactive protein, these are looking for general inflammation, and the ECG looking for changes in their heart related potentially to the valve disease. So the only one that you would not be checking is the myoglobin. So if you have a VSD that creates a left to right shunt with excessive pulmonary blood flow and pulmonary pressure, what does this result in? Peripheral edema, pulmonary ischemia, or pulmonary hypertension? So good job for several of you. So the thing that kind of gives the point initially says and excessive pulmonary blood flow and pulmonary pressure. So over time, they develop pulmonary hypertension. In the early stages, it's just pulmonary edema. If it left untreated, eventually develop pulmonary hypertension. So because it says in the question stem here and pulmonary pressure, the best answer is the pulmonary hypertension. So this is that you see, any of those left to right shunts, ASC, VSC, PDA, over time, they can develop pulmonary hypertension. This is another select all that apply. What are the signs and symptoms of hypothyroidism? Cold intolerance, constipation, weight gain, and bradycardia. All right, good job. So this is, if they haven't been diagnosed with hypothyroidism or they're not on a high enough dose of their replacement medication, you could see all of these things. What is parallel play? Playing with other children, playing alongside other children, but not with them, playing alone, or playing checkers with another child. Good job. Playing alongside, like two children playing near each other, but not with each other. At which age does a child begin parallel play? 2 to 3, 0.2 months, 0.2 years, 3 plus, or 0 to 2? Yeah. So you really kind of expect in that toddler years around 2 to 3 is when you would expect them to be doing the parallel play. So another select all that apply. What type of infection is acne? Local, bacterial, fungal, or viral? So very good. So local and bacterial are the two correct answers. Systemic would be not just localized to one area. So it's usually like on the face or the back, and then it's a bacterial infection. One of the treatments is to take antibiotics. This medication treats both acne and sinus infections. Tobramycin, ciprofloxacin, penicillin, and doxycycline. You just choose one. It's doxycycline. This is one of those medications. You should also remember that it's contraindicated if you're pregnant. It can cause damage to the developing fetus, but it is a common medication for both acne and sinus infections. I think more common for acne than sinus infections. A usual treatment for an infant with hip dysplasia is what? A body cast, a Pavlik harness, triple diapering, or aggressive physical therapy. So it is the Pavlik harness. It's a harness that helps pull the hip back into the socket. So this is another select all that apply. How do you diagnose hip dysplasia in an infant? Positive Ortolani maneuver, asymmetrical folds in the buttocks, affected leg shorter than the other, or the foot points inward for the affected leg. So good job. So the Ortolani maneuver is when you put them on their back and you rotate their legs out and you'll hear a clicking sound. See a shorter leg, symmetrical fold in the buttocks are also indications of hip dysplasia. So which of the following is included in the nursing care of myelomeningeal? Assess urinary function, place infant in a supine position, use a latex glove when providing care, and assess neurologic function. You only select one. Oh, I'm sorry. I forgot it was a select all. So the myelomeningeal, that's when part of the spinal column comes out in like a little bubble. You'll see it on their back. It looks like a little bulb. So they tend to not have normal function below the myelomeningeal. So sometimes they need to be straight cathed. So you need a sensory function and then assess neurologic function. You don't want to put them in the supine position because you need to be putting pressure on that little ball of spinal cord that's coming out. And they tend to be very sensitive. So they have a higher incidence of latex allergy than other patients. So you don't want to use latex gloves when you're caring for them. Most important principle of nursing care for a child with myelomeningeal is what? Asepsis, hygiene, rest, or exercise. So it is asepsis. Until they've had surgery, they're at risk for getting an infection where that area comes out of the base of their spinal column. So you need to make sure that you're using good aseptic technique. So what priority nursing action must be taken when caring for a baby with myelomeningeal? Position the newborn supine, protect the sac, assist with bonding, or place an NG tube. Okay, yes. So the picture that was on there is what it is when there's that bulb that kind of sneaks out. So you want to protect the sac is the most important thing. So and make sure their area is protected before they go to surgery. If the nurse is teaching about epistaxis management to a patient, what would be most appropriate? Tilt your head backward and pinch your nose. Blow your nose gently with your neck flexed. Lie down flat and place an ice compress over the bridge of the nose, or sit, lean forward, and pinch the soft portion of your nose. Yeah, so that's just the medical bleeds. Good job. You want them kind of leaning forward. If they're leaning their head back, they can swallow that blood. So you want them leaning forward and pinching off the area. What medication would you question if a person has epistaxis? Sudafed, aspirin, Tylenol, or none of the above? So it is aspirin. We don't give aspirin much in kids because of the risk for Reye's syndrome, but it also decreases platelet aggregation, so it makes them at higher risk for bleeding. So you would question that if they had a nosebleed. If a baby is diagnosed with epispadias or hypospadias, what would you teach the parents? The baby will need a urostomy. The baby will be circumcised in the hospital. Circumcision will need to be delayed, or this will not affect the baby at all. Right. So in this one, circumcision will need to be delayed. It can't be right in the newborn period because they might use the foreskin as part of the repair. When is surgery recommended for hypospadias? 6 to 12 months, 24 to 48 months, 12 to 18 months, or surgery is not needed? So you guys were kind of split. Yeah, definitely before you start potting. 18 months is kind of at the upper end. We usually say definitely by 15 months. So 6 to 12 months is the best answer. What does folic acid do for sickle cell disease? Folic acid helps make new bone cells. Folic acid, that's just not a complete sentence. Folic acid interferes with RNA and DNA to help make red blood cells, or folic acid helps make new red blood cells. So this one is kind of worded a little bit weirdly. So it's not just for sickle cell disease, for all of us. Folic acid helps make new red blood cells. So to kind of remember that, but with sickle cell disease, sometimes they can be on folic acid because they have their red blood cells that are misshapen. How does folic acid supplement aid child sickle cell disease? I'm going to go ahead and skip this one because it's the same thing over and over again. So when measuring urine output on an infant, 1 gram of diaper weight is equal to what? 1 milliliter, 3 milliliters, 2 milliliters, or 4 milliliters? Okay, it is 1 milliliter. So if you're ever asked to figure out how much a baby weighed in their diaper, you wear the dry diaper weight and you subtract that from the wet wiper weight, and that tells you how many milliliters of urine they had. So this is another select all that apply. Pyloric stenosis signs and symptoms include forceful projectile vomiting, poor weight gain, babies are always hungry, current jelly stool, and abdominal distension. Okay, so the forceful vomiting and the bad weight gain and their babies are always hungry. So the current jelly stool, that's associated with a GI problem called intussusception, where the GI tract telescopes on itself. It causes an obstruction. And then abdominal distension, they don't have abdominal distension. They're not able to keep their food down. It doesn't go down through their GI tract. They vomit it all up. So these two, the forceful projectile vomiting and the bad weight gain, and they're always hungry. So hypertrophic pyloric stenosis, the main symptom is an upset stomach, diarrhea, projectile vomiting, or a palpable mass. All right, it is the projectile vomiting. Sometimes you'll have that olive-shaped mass that you can feel, but the thing that you really associate with pyloric stenosis is that projectile vomiting. Causes of autonomic dysreflexia: urinary retention, dehydration, hypotension, or none of the above. All right, so I'm impressed that half of you knew this. So I know this is something we didn't talk about in class. So does anyone know, when do you see autonomic dysreflexia? What type of injury precedes a patient having autonomic dysreflexia?
Spinal injury.
Head injury.
Spinal cord injury. So yeah, those of you that are going to be working in rehab, you might see this. So, you know, urinary retention is one of the things that can cause it, rapid position changes. So the autonomic nervous system is your involuntary nervous system. So things go haywire, you activate their involuntary nervous system and they develop like hypertension, bradycardia, profuse sweating. They can become very unstable if they go into an autonomic dysreflexia crisis. So urinary retention is one of those things. If they're not peeing, sometimes you have to straight cath them before their bladder is full, or they can kind of spiral into this process. So autonomic dysreflexia presents with headache, hypotension, and bradycardia, headache, hypertension, and bradycardia, headache, hypertension, and tachycardia, headache, hypotension, and bradycardia. All right, so yeah, this is one of the hypertension and bradycardia are the two things that, and excessive sweating, those are the things that I usually associate, but then also headache. So to kind of remember, these are, you know, if you have a patient that's had a spinal cord imaging and you see their blood pressure, specifically in their heart, blood pressure go up and heart rate go down, you need to be worried that they're having an autonomic dysreflexia crisis. So another select all that apply. Nursing interventions for autonomic dysreflexia, bladder bowel training, hydralazine for hypertension, dangle feet at the edge of the bed, or give vasoconstrictors. Yeah, so the one that you're not going to do is the vasoconstrictors. Vasoconstrictors is going to raise your blood pressure more, which they have a high blood pressure when they're in a crisis. Dangle feet at the edge of the bed, rapid position changes can precipitate autonomic dysreflexia. The bowel and bladder training, this is, you know, maybe they need to be cathed on a regular basis, or they need a very specific regimen to make sure they don't get full of stool. Hydralazine, this isn't going to affect their heart rate or anything like that. It's a blood pressure that you specifically use in this patient population because it will lower their blood pressure without affecting their heart rate at all. Lyme disease is caused by an infected deer tick. Is that true or false? So that is true. Good job. So Lyme disease treatment includes cryotherapy, doxycycline, nystatin, or colloidal oatmeal. So it is doxycycline. So what is a side effect of Lyme disease treatment? Migraines, soreness of muscles, swelling, or forgetfulness? So it is the muscle soreness. Select an appropriate snack. Oh, this one I'm going to skip. I don't agree with this one. So we'll go on to the next one. Propranolol is used for hypothyroidism and can decrease thyroid hormone synthesis. Is that true or false? All right, so that is false. Propranolol is a beta blocker. You use it a lot of times for blood pressure control. What it is the primary use of PTU in the management of hyperthyroidism? To replace deficient thyroid hormone, to treat thyroid cancer, to increase the production of thyroid stimulating hormone, or to decrease the production of thyroid hormone. All right, so good job. So thinking about hyperthyroidism, they have too much thyroid hormone. The most logical answer, even if you hadn't recognized the name of this medication, is that that's going to decrease the production of the thyroid hormone. So symptoms of a UTI in children: not eating, fever, cloudy, dark, bloody, or foul smelling urine, or all of the above. Yeah, good job. All of the above. The recommended schedule for DTaP is 1 month, 4 months, 8 months, and then 15 to 18 months, 2 months, 4 months, 6 to 15 months, 2 months, 4 months, 6 months, 15 to 18 months, and then 4 to 6 years, or birth 1 to 2 months and 6 to 15 months. Yeah, so I can send you guys the vaccine schedule to kind of look at. So this is one of the ones that's given at every well child check. So 2, 4, 6, and then 15 to 18 months and 4 to 6 years. This is the one of the ones that's in that group that they get throughout their infancy into early childhood. So usual treatment for him with an infant with hip dysplasia is a body cast, a Pavlik harness, triple diapering, or ORIF hip. So very good. We had that earlier. The Pavlik harness is the treatment. A sign you might note when assessing developmental hip dysplasia: two skin folds on the back of both thighs, hypotonic leg muscles, one leg shorter than the other, or bulging at the hip area. So good job. So it's normal to have the two skin folds, but if they're unequal, that's something that you're worried about. And the answer is the one leg shorter than the other is the correct answer. All right, another select all that apply. Which immunizations are required for school-age children? Varicella, measles, mumps, rubella, the DTaP, or the polio virus? And it could be up to all of them. Good job. It is all of them. So Pavlik harness must be worn 6 hours a day, 23 hours a day, 12 hours a day, or however long the baby can tolerate it. So it is 23 hours a day is how long the baby needs to wear it. So an infant with hip dysplasia wears a Pavlik harness. What are appropriate nursing interventions? Maintain flexed and abducted position of the hips, maintain direct skin contact with the harness, take off the harness for bathing, or administer sponge baths. So yeah, I think this is worded because this is our appropriate, it's not a select all. So the administer the sponge baths because you have to leave them in the heart for 23 hours a day. So let's select all that apply. Caregiver teaching for a patient with a Pavlik harness include refrain from holding, checking for skin breakdown, understanding the child will be delayed, or continue to diaper around harness. Yeah, so for skin breakdown is the main thing that you need to make sure that since they're going to be in that harness for so many hours a day. So nursing interventions and patient teaching for the treatment of head lice and scabies. Oh. So clothing, linens, and bath articles thoroughly cleaned in hot water, special carbohydrates to promote healing, complete isolation from the public, or cut off and shave all the hair. Yeah, so for those of you that answered, they're both highly contagious. They spread through families quickly, so you need to make sure that you wash everything in hot water. Which comment by a parent whose child has head lice indicates the nursing education was effective? We're all using medicated soap to kill the lice. I have washed all hats and linens in soapy hot water. I frequently check the scalp of the children for reinfection. We are no longer attending school. I'm homeschooling them from now on. So yeah, this is getting back to the same one that you really need to make sure you wash everything in the hot soapy water. All right, select all that apply. Which of the following nursing care interventions are appropriate for respiratory distress syndrome in infants? Suction, provide adequate environmental stimuli, maintain temperature, and administer oxygen as needed for saturations greater than 90%. So good job. You make sure that, most children we do talk about adequate environmental stimulated, but really respiratory distress, they kind of need a calm environment so they can get better. So these things, sighing, oxygen, making sure making sure they're maintaining their body temperature. Which of the following is the mainstay of nursing care for bronchiolitis in children? Adrenaline, hypertonic saline, that's for a nebulizer solution, salbutamol, or corticosteroids? Yeah, so we didn't talk about this. This is one that was not. So they can breathe in the hypertonic saline and it helps loosen up their secretions so that you can get more of them out. Depending if they develop like asthma type symptoms, you might be thinking about corticosteroids, but the first thing that you would try would be like a hypertonic saline neb and help loosen up the secretions so you can suction them out better. Leading cause of childhood poisoning is plants, medicine or drugs, gasoline, or flowers. Yeah, good job. And one of the most common ones is actually Tylenol. Always remembering that over-the-counter medications can also be dangerous. Teaching for prevention of UTI includes all of the following except void after sex, wear cotton underwear, wipe from front to back, limit fluid intake. Yep, good job. You want them drinking fluid, helps prevent urinary stasis, which is a risk factor for a UTI. So another select all that apply. Signs and symptoms of appendicitis include rebound tenderness, bloody diarrhea, abdominal guarding, and pain at McBurney's point. Yeah, so the bloody diarrhea is not, but the other three are. So good. So appendicitis signs and symptoms include localized pain in the right lower quadrant, pain with hip flexion, and tenderness at McBurney's point. Is that true or false? So that is true. Nice job, you guys. So which parameter would the nurse consider when assessing a child with cystic fibrosis? I'm going to skip this one also because I feel like it's worded very strangely. So a nurse is assessing a toddler who has cystic fibrosis. Which of the following findings should the nurse expect? Rhinorrhea, weight gain, visible peristalsis, or steatorrhea? Yeah, so this is a word just to kind of recognize this is fatty stools. So kids with cystic fibrosis, people with cystic fibrosis, they don't produce the same pancreatic enzymes because their ducts get clogged with a thick mucus. So they have a hard time breaking down fat. So they have these thick, frothy stools. We describe that. The medical for that is steatorrhea. So respiratory signs and symptoms for a patient with cystic fibrosis: respiratory infections, chronic congestion, low tolerance for exercise, forced vital capacity, forced expiratory volume, sputum production, use of accessory muscles, decreased pulmonary function, or all of the above. Yeah. So, the main thing to remember with cystic fibrosis, it affects a lot of systems in the body, but primarily the lungs. They end up with the thick mucus clogs. They end up, with decreased exercise intolerance, a lot of sort of asthma symptoms in terms of their decreased lung capacity and the frequent respiratory infections. So signs and symptoms of esophageal atresia or tracheoesophageal fistula: excessive drooling, increased respiratory distress when feeding, choking, coughing, or all of the above. So that's another all of the above. This is one where you don't necessarily diagnose it before they're born, and then their first feed, you see them coughing and sputtering when they eat. Which of these is not a sign and symptom of transesophageal fistula? Unable to properly feed, current jelly stools, frothy saliva, stomach distension. So yeah, the one that is not curly stools, this is this very specific characteristic of intussusception. You don't see this with any other GI diagnosis, only associated with intussusception. So patients with esophageal atresia or transesophageal fistula may have which of the following signs and symptoms: coughing, crawling, startling reflex, fever, shortness of breath, rosy cheeks, coughing, choking, cyanosis, coughing, choking, and a runny nose. So coughing, choking, cyanosis is the best answer here. You don't really expect a runny nose. It's all related to them not able to swallow their milk. Impetigo teaching would include apply antibiotics over the scabs, apply santinol to remove dead tissue from wounds, remove honey crusts, and clean before applying antibiotics, or clean and apply cotrimazole antifungal. All right, so this is the one that's like the skin infection is bacterial. It spreads very, very quickly, very common. Once it hits a daycare, like all the kids in the daycare get it. And it has these honey crusts on it. So you want to kind of gently wash those off and then put the antibiotics on the lesion after you wash them off. Teaching to a child with impetigo includes cleanse the area with hydrogen peroxide, apply a topical antifungal, give oral antibiotic for 3 weeks, or remove crust after soaking in a 1 to 20 Burroughs solution. So this one was a little bit tricky. It's bacterial, so you're not going to give the antifungal. Hydrogen peroxide would be irritating. So we didn't talk about solution in class, but it's a liquid with aluminum acetate, and it helps alleviate itchy, burning skin. So you don't have to use Burroughs solution, but in context, this is the best one. You want to kind of soak it or apply something and kind of loosen up those yellow crusts and get those off, and then put the topical antibiotic. It's usually not necessary to give oral antibiotics. Usually just treat it topically with a topical antibiotic. So another select all that apply. What are digoxin heart rate parameters for infant and child? So an infant less than 100, infant greater than 120, child less than 90, child greater than 120. So pretty good. So remember with digoxin, it lowers your heart rate. So normal for babies to have a higher heart rate. Hold it for an infant that had a heart rate less than 100 or a child was less than 90. Digoxin requires an apical heart rate for 1 minute prior to administration. Is that true or false? So that is true. Good job. When might the infant experience physiologic anemia? 1 to 3 months, 2 to 3 months, 0 to 1 months, or 3 to 6 months? All right. So yeah, physiologic anemia in infancy. So infants are born with some fetal leftover iron reserves in their liver that they get from their mother throughout their pregnancy. And those are gone by around between 2 and 4 months. So they no longer have those reserves that they were born with. So then frame, that's when they're likely to develop physiological anemia. We worry about this particularly in breastfed infants because breast milk doesn't have a very high concentration of iron. Babies that consume formula, the standard formula has iron supplementation in it. What causes rheumatic fever? Bacteria, viruses, compensation, overcompensation of the immune system, or contaminated food. So I thought this one was tricky. It is caused by strep throat. So I felt like red was a answer also, but it is like the body's overreaction to that strep bacteria that causes the symptoms. So it's not just the bacteria itself. Not everyone that has untreated strep throat goes on to develop rheumatic fever. So the body overcompensates for this bacteria, and that's why you get the systemic widespread response. The thing you worry about the most is the heart disease damage, but they have systemic systems. It's really like an autoimmune overcompensation of the immune system. What sign is indicative of respiratory distress in infants? Nasal flaring, grunting, intercostal reactions, or all of the above? Good job. So it is all of the above. So another select all that apply. Identify the cardinal signs of respiratory distress in infants. Increased heart rate, nasal flaring, retracting, cold and clammy, grunting, and or apnea. So the only two that were not on there were the cold and clammy, and apnea obviously is a problem, but it's, not, you are in respiratory distress before you develop apnea, increased heart rate, nasal flaring, retracting, and the grunting. So the HPV vaccine schedule, when would you give it? 7 to 8 years, 16 years, 11 to 12, or 18? So you want to give it to them before they're sexually active. So 11 to 12, if you miss that window, they can get it when they're older, but it's best to give it around 11 to 12. Symptoms of diabetes mellitus include polyuria, polydipsia, hypoglycemia, weight gain, and fatigue. Is that true or false? So that is false because of weight gain. So they don't have weight gain when they have diabetes. They can have weight loss, but not weight gain. Polydipsia in diabetes is caused by cellular starvation of energy, fluid loss via the urine, high osmolality, or acidosis. So it's a little bit tricky. So high osmolality, so the high sugar in your blood causes the osmolality of the blood to be higher, and your kidneys try to compensate that by spilling more sugar in your urine and increasing your urine output. And then as a result, you feel really thirsty. What causes autism? Pregnancy defect, brain abnormalities, childhood trauma, or there's no single cause? Good job. So there is no single cause. We don't exactly know what causes autism. So signs and symptoms of autism include cannot maintain eye contact, repeats words or phrases, hyperactivity, or all of the above. So it is all of the above. Nice job. So autism affects which areas? Communication, behavior patterns, social patterns, or all of the above? It is all of the above. Very nice. Most common leukemia in children: ALL, CLL, AML, or CML? So yeah, this is another one that I know that we didn't talk about. So the two types of leukemia are ALL and AML, and ALL is more common in children. So all of these are signs and symptoms in acute myeloid leukemia except fever, petechiae, infection, polyuria. Yeah. So polyuria is not. So bone marrow cancer, leukemia is a bone marrow cancer. So it affects your ability to produce blood cells, white blood cells included in them. So PKI because of clotting factors, the little spotty bleeding, easy bruising, something that you would not expect in a patient with leukemia, either ALL or AML is the polyuria. Which of these signs and symptoms are most common in the initial phase of leukemia in a child? Sore throat, high fever, hyperactivity, or low grade fever? All right, so this one pretty good. So I think the key phrase here is the initial phase. So they're just starting to get sick. They don't really hit to a big hit to their immune system yet. So you're going to expect a low grade fever. As it goes on, you're going to expect to see higher fevers, but in the initial stages, general malaise and a low grade fever. So another select all that apply. Nursing care for a child after a tonsillectomy includes frequent pain medications, gum, spicy foods, or ice bag to the neck. Good job. So no spicy foods. You don't want to irritate that area. But the pain medications, ice bag to the neck, gum can help produce saliva so that it can kind of help keep their mouth moist. So a child after tonsillectomy is swallowing every 2 minutes. What should the nurse do? Offer warm liquids, offer an ice collar, inspect the oral pharynx, or give pain medicine? So good job. You're worried about postoperative bleeding. I've also seen Hesse-NCLEX questions where the answer is notify the provider. So you do need to be concerned about swallowing frequently after a tonsillectomy. They could be bleeding near the incision site, which can sometimes be hard to see. So during the cystic fibrosis sweat test, which two electrolytes are being searched for abnormal transport? So which are the two electrolytes that they don't transport normally? Potassium chloride, sodium, magnesium. And there's two. So it is sodium and chloride, your salt. Kind of remember these kids taste salty. So and these two electrolytes, they bind each other. So they frequently go together. Sweat test helps diagnose cystic fibrosis. Is that true or false? So that is true. Very nice. What is the treatment for nephrosis? This is speaking about your kidney. Hypertensive, steroids, diuretics, antibiotics, and hypertensives, naproxen or Tylenol. This one's a little bit tricky. I should have pointed out hypertensive. She's saying antihypertensive, steroids. We talked about nephrotic syndrome. So the mainstay is really steroids. But if they get hypertensive, you would give them an antihypertensive and also diuretics to help move fluid off. So the medication Albacet is used to treat fungal infections. Is that true or false? Okay, so that's another one that I know we didn't talk about, so I'm impressed. Happy you knew that. Just kind of file that away as something that was missed by other students in last year's HESI. So another select all that apply. How should a parent check for pinworms? Perform visual inspection of anus 2 to 3 hours after the child is asleep. Abdominal palpation. Tape test a loop of transparent tape firmly against the perianal area. Remove the tape and place it in a glass jar and give it to the doctor. Yeah, so it is these two. It's the tape test, but you don't expect parents to have to interpret the tape test. They bring it into the doctor to look to see if they can see the little worms. Which of these medications are not used for treatment of pinworms? I am bad at pronouncing them, so I'm going to go ahead and let you guys read them. So the one that is not is the pyrantel pamotate. One thing that I can say is like a trick to try to read is that the ones that end in azole are kind of more parasitic. So just we did not talk much about pinworms. So if you want to write this down, I'll give you guys a second. So anabolic steroids side effects include high blood pressure, jaundice, acne, increased risk of cancer, and shrinking testicles, increased aggressiveness, violent mood swings, or all of the above. So this is kind of talking about like kids that or athletes that give themselves steroids to help them increase their sports performance. So it is all of the above. All right, last one. Dun, 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 dun. Oxygen or mist tents you use for croup and cystic fibrosis in young children have a flow of 5 to 10 liters per minute, 12 to 15 liters per minute, 15 to 20, or 1 to 6. All right, I'm impressed. We did not talk about this. So 12 to 15 is the right answer. All right, so who is C? Oh, Rachel or C? Oh, very nice. What does C stand for?
My middle name is CSEA.
Oh, nice. Okay. So good job, everyone. I will post this Kahoot and another Kahoot in case you want another one. I think the second one has 100 questions, and they're both a good review for the NCLEX, I'm sorry, the HESI. Like I said, this one, Dr. Bogart went through and looked at the most missed questions across the campuses last year and then came up with this. So it's a little bit more tailored to how people did last year. And the other one is kind of more of a general review of the entire course. Does anyone have any questions or concerns about anything? I'm gonna do a quick review, everyone's cameras, see if anyone's giving me a head nod. Okay, if no one has any questions, then you guys are free to go. Remember to make sure that you schedule your HESI. Remember to make an appointment with me after your HESI if you would like to talk about your grade or you have any questions about the class. And then please, please, please fill out the survey when you get the email where you get a review of the class. And send me a message if you have any questions, okay? Good luck on your HESI, everyone.
Thank you. Take care.
Thank
Take
you.
care,
Have a good
bye-bye.
day.
You too.
Thank you. Have a good day.